In Fox 5 Health News, the flu season may have gotten off to a slow start, but experts say it is more than making up for it now. The CDC says the virus is gaining speed, especially in the South, where 7 children have died since last week. The predominant strain this season can cause severe illness. It has been seen in 90% of patients tested. The agency says everyone over 6 months of age should get a flu shot, but despite this recommendation, fewer than half the U.S. population has been vaccinated.
All right, more evidence that a simple blood test may help predict which breast cancers are likely to return. Joining us now, Fox 5 medical contributor Dr. Devi Nampaya-Parampil from the NYU School of Medicine.
That's kind of a breakthrough study.
I think so too. I think it's very promising. So this is a study that's looking at people who've had breast cancer, not the localized kind where we can at least say there's a cure, but where it's had some spread to the lymph nodes, but not to the rest of the body. So there's some variability in terms of the guidelines for that. So if a person has surgery, they have other treatment, they can sometimes be put on medications, maybe for 5 years, maybe for 10 years. So some people will benefit from that treatment. Some people may not need to be treated for as long. So this is a blood test that will look for stray cancer cells in the blood and basically use that to tell whether you have a chance of developing cancer, a higher chance of developing cancer the next few years.
But that's so exciting. I mean, one day that could pave the way for even detecting cancer before it starts, if it can detect stray cancer cells in your blood.
Exactly. So that's the idea, that if you can detect the cancer cells, then you could get treated for longer, preventatively, prevent the recurrence, right? But if you don't have any sign of the cancer occurring, then maybe you can avoid the side effects of these treatments and have more peace of mind. So it would be really good to have that information. The question here with these studies is it's a preliminary study, right? There's some evidence, but we don't know for sure. There could be a false positive. Let's say the test says that you're going to develop cancer. Some of those patients haven't, so we don't know if that means they will in the future or the test was just wrong.
Interesting psychological conundrum there.
Yeah, but then
you don't want to make
then
people
you can kind
suffer.
of target your therapy. They're like, you have a 22% increased chance. So more information is helpful. Okay, so this is information that I don't know if it's helpful. It's worrisome. Alzheimer's cases are expected to skyrocket by the year 2060, and experts say the U.S. won't be ready to handle the high number of patients and the families too. It's a big burden on so many people.
Sure, this is very concerning. I mean, the number is going up, and on top of that, we don't have a cure for Alzheimer's. So most of the treatments are aimed towards symptoms, right? To try to slow down the progression of Alzheimer's, to make the symptoms more manageable. I think, we're used to thinking about Alzheimer's as a disease of the memory. So people are having a hard time remembering things, kind of forming new memories, but it can actually affect a lot of different things. So there are stages before Alzheimer's where people may have problems, let's say, with driving. So you can also see things like more car accidents, for example, right? You can have problems just balancing your checkbook, so you could have the person also have a lot of financial problems even before they have memory deficits and stuff. And of course, there are people who prey on these
There's a lot of
folks.
signs that are only obvious in hindsight, it seems like.
Exactly.
Things,
So I would say if people are starting to develop these symptoms, or you notice something in a family member where they seem a little bit more confused, their thinking is a little slower, sometimes they're having trouble understanding, still better to try to get the treatment, even if it's for symptoms, right? Because at least that can kind of slow down the progression. And then hopefully these companies that are looking for treatments will actually be able to pour more money into that area. It's difficult because they've met with some costly setbacks in the past.
Why do you think they're seeing more and more cases of Alzheimer's disease and saying it's going to skyrocket by the year 2060? Is it because we're living longer than we were before?
Yeah, that's
or we're
definitely
noticing it more.
Maybe a combination of both.
It
It could be a combination of all of the above, but the life expectancy is definitely a factor. I mean, hundreds of years ago, if your life expectancy was 40,
60 years or whatever.
we wouldn't see this. But now we're living longer, we're seeing some different problems.
All right, take the good and the bad. Dr. Devi Nampaya-Parampil, thank you so much.